So I'd like to invite Desiree and Steve to comment on what they've heard this morning, particularly on our last two talks, and to lead a discussion that hopefully will involve all of us. So Steve and Desiree, come on up.
Those were two incredible talks, and I'm eager to hear from the audience. I'll say two short things, and then Dr. Shuchter wanted to go after me. Well, I was lucky to be one of the graduates from the Community Psychiatry Fellowship under Dr. Chow. And he just does so much on a national level, local level. He's always working and such an outstanding leader. And I really have felt that community presence in my training and then in my practice. And I hope to hear more about that from the audience. Dr. Ankoli Israel's talk, oh my goodness, I have to take a moment and just kind of breathe on it because it was so powerful. And I feel like it was written just to me. So I'm a newer mom, I got the guilt, I have the, okay, how am I gonna do the percentage FTE kind of thing? And I sought out a lot of mentors. So I talked to Steve Coe as a friend, a mentor, supervisor, Ben Maxwell. I reached out to Alana and Dr. Zizik and all these people outside of the institution. So I had that individual conversation. And I'm just wondering, for you, Dr. Ankoli Israel, and then others, how do we make it into a larger conversation? How do we discuss it at a societal level, at an institutional level, and really go beyond kind of these small talks? Okay, how am I going to figure it out? It's such a secret. But to really think of a collective solution creatively. And then broaden it from that to new dads, to family transitions. How are we well at home, and how does that extend to wellness at work and productivity? And at a human level, we can really do well when we feel supported in all of those domains. So thank you. So many thanks to that.
Thank you. I thought Sonia was talking to me personally, but that's just me. However, this morning our speakers were a kind of a tour de force of the history of clinical program, clinical training, and involvement in the community. I had a certain degree of PTSD-like symptoms as I was living through a period of time that was not that pleasant all the time, but we struggled through it and managed to survive. I don't know what to add. Again, this was a tour de force by the people who outlined the programs in the department, and I don't know if they kind of open it up for discussion if there are other observations. Now, I was actually going to talk about something that was dear to my heart after that, but questions, comments?
Could I also maybe fill a few moments while people are getting seated with a couple of extra comments to just underscore a couple of points. First, in terms of the history, now that Arnold is here, we might ask him about how he ended up selecting Fifth and University as the building to set up the community programs. I have to say I was one of the beneficiaries. It's the only time I had an office in I think it was the bank manager's suite on the third floor. It was wood paneled. It was very nice. And we also recall affectionately interviewing patients in the vault that was mentioned before. I'm wondering if Arnold might comment on a historic note. How did you end up with that?
Of necessity. We were so under-resourced as a department. As I mentioned a couple of days ago, we didn't have an inpatient unit, we didn't have a clinic, and we didn't have research space.
But it was a great job beyond that, as chair, right?
Yeah. So, and I started to, they expected us to go quietly and just consult on the county hospital, an already ongoing and poorly run clinical operation. I knew I couldn't ever attract a faculty of any quality to that, and nor could I imagine residents being attracted to that. And so I started a program, a personal program, to nudge and nudge and nudge and nudge and nudge, and didn't do very well for the first couple of months. And one day, I was having lunch with one of the people that wanted to, community people, and they described the fact that they had, a bank had just moved out of this building, and he didn't know what he was going to do with it, or she didn't know what she was going to do with it. And I said, how about making a psychiatric clinic out of it? And she looked at me strangely. And then we sat down, I guess the week after, and I arranged in between time a mortgage discussion with other banks and so forth, and just purchased it personally. Purchased the bank building myself, and then reported to the dean and the chancellor and so forth that we now had a clinic space, and the dedication was we could have a day hospital, and that was what I used as bait. They wouldn't have to give me somebody's precious inpatient space. We could do a day hospital. Day hospitals were just coming in at the time. We called it the Browning of America because the head of NIMH was Brown, Bert Brown, and he had the bright idea that people were being, the political climate at the time was that people were being committed for political reasons, and so that they decided to do this community medicine, a community psychiatry approach, and using day hospitals, and close the state hospitals. And that was a period of time when that happened, which was awful because it turned out that the day hospital system in the community didn't work very well, and people were on the street, essentially. And so the bank building became a clinic and a day hospital. And the chancellor, I had to go around to the chancellor's office and and Sacramento, and I was criticized and almost fired, and then people began to use the bank building, and it became the wonderful social worker Kurt Gifford, who was named for it, was killed in a traffic accident. He was a very instrumental person in running around and covering my bases in the community, and that was a terrible thing because I had to leave my lab and spend the full time trying to cool out the community to make this bank building work, and it did, and it became a symbol. And what was interesting about it was because of its location and its context, people who wouldn't have voluntarily walked in to a psychiatric clinic felt welcome. And it became a walk-in place that was very available, and the community used it without the rigmarole of transition to being in a psychiatric label. So it paid off in so many unsuspected ways that it became a symbol in a way of our make-do department.
Thanks. It's just Pat had given a talk earlier about the history. I thought this might be an interesting elaboration of that. Anyway, I don't mean to hijack the program here. Thanks.
Thank you for asking.
Actually, it was a wonderful history and overview, and it brought back so many great memories. I'm Jeff Chow. I was one of the products of the program back here, and I think my year was the first year we had an internship program led by Nancy, and I served under the my surrogate parents of Steve Shuchter and Pat Judd at Gifford Clinic during the managed care era, which, at the time it didn't really seem as as a positive experience with dealing with insurance companies, but I think since then it's kind of always gotten better, and I think my years at Gifford were probably the most educational and I tell all my friends and colleagues that was the year that I learned the most about being a psychiatrist that I ever had, and actually I think I was so fond of it that after going into the community, as Steve Coe alluded to, I went into practice with some of my residency friends, Eric Rimo, Natalia Fudum, and Julie Cook, that we worked together back in the program, and we've been together in practice here in San Diego for, I think it's over 20 years. So I think that the impact that the program has had on me and my life, and what we've been able to give back to the community through the organized medicine and kind of supervising other residents, has been immensely rewarding and enriching. And so it's just a wonderful experience to see it all kind of come together and so succinctly and a terrific celebration.
Thank you. Thanks, Jeff. It's so nice to see so many of our former trainees here today.
So I just want to say thank you and hello to all my mentors who are here. My name is Cristiane Bertual. I'm also a product of this department. I graduated in 2014. And I just want to tie up together a little bit what you've talked about. I actually had the opportunity to follow up Thursday, Friday, and today. And I'm so honored to be here, and being a graduate from this program. And surprisingly to myself, I thought when I started this program that I would work in private practice. I'm actually working to the correctional department. And I think that is a bridge between what Dr. Coe was saying about the community and the leadership that this program offers. And how can we think as community? It's amazing what has been done there. Unfortunately, it's also ties with Dr. Judd was saying about how psychiatry evolved over time. And I don't think we all expected we would see our most severely mentally ill people in prison, but that's what's happening. And so that's food for thought of how, with the policies, and how can we change that. That said, I witnessed wonderful programs that are being established at here in the Mayo Correctional Institution here at Donovan, that it was very surprising to me, the number of rehabilitation programs that they are offering. And what concerns me, and maybe this is something to think about, is when they parole, how are they going to have access to the treatment? And I think the community service comes in with that, because imagine if our private patients cannot find a private psychiatrist who accepts insurance, what is going to be for those folks, right? And also, I was thinking about Desiree, and I'm also a mother. I have a 14-year-old son, so one thing that we've been listening a lot in the community as parents is all about the school shootings, and I know Desiree is going to start a program so my son goes to a private school, and the whole Sandy Hook movement, I don't know if UCSD has anything that they thought about it, but it's something for the community and the public policies to think about. And finally, just in my personal level, I love your talk, Dr. Israeli, and I want to thank again UCSD. When I came here, my son was 6. And so being a woman with a 6-year-old and being an immigrant, and you guys accepted me, so I want to say thank you to all of you.
Thank you. So This is it's amazing to see the growth of the department in so many ways. Internally, the role of women in leadership roles in the department has been incredible, and thanks for starting that off for us, Sonia. And the role externally that our department has had in both local and national leadership in the community at large that Steve reminded us of, and really put a stamp on the importance of continuing to do that and growing in that area. Thank you all for a great start to the day.